Hello, everybody. My name is Coty Dennler, and I am a certified occupational therapy assistant, and I'm also a certified aging in place specialist. Thank you guys for listening to my presentation. I'm excited to present to you guys the research and project that I was able to do on the access to medical adult day centers in a rural environment and the effects that that has. So the problem here is that older adults in rural areas, they face significant barriers to healthcare in general, including at a much greater rate access to medical adult day centers. This is even more highlighted in participants who have chronic illnesses or dementia. Also, caregivers in rural areas experience significant stress and burnout due to the lack of available respite care services. So, some of the background information here is that evidence shows that medical adult day centers do improve physical and psychological health that reduce for the patients or the residents or the clients, however the model exists. So also that they help to reduce caregiver burnout, increase social connections, and lower hospitalization and institutionalization rates. In rural Appalachia, where I live, I have collected quite a bit of informal feedback from caregivers in my experience as an occupational therapy assistant that just it underlines the stress, the high levels of stress that they face because they just don't have any respite services. Um, this leads to them having to quit their jobs to take care of family members because there's just no other options. And if there are options like in home care and things like that, it is so expensive that they end up having to. It is cheaper for them just to quit their job and take care of their loved one themselves. Also, some background information is that healthcare providers that I've worked with, they talk about these preventable hospitalizations because people are at home when they alone when they shouldn't be, and they're just not having any health access. They're not having anybody that is helping them manage their daily medications and things like that. And there's multiple examples of that through informal feedback given from healthcare providers that this doesn't need to happen. So the significance of this issue is that the lack of these medical adult day centers that this project is focused on, it affects their older adults' ability to age in place, to manage their chronic illnesses, and to maintain social connections, which we all know leads to more extensive issues down the road. So some data that goes along with this. By 2050, 22% of the global population will be over 60 years old, with rural populations being disproportionately impacted by these inadequate healthcare services. As I said earlier, being from this rural Appalachian region in the United States, um, I get to see this firsthand how we're just simply not prepared for the older adult population to grow. Some other data is approximately about 20% of older adults in the United States live in rural areas and face a 40% shortage of primary care providers compared to more urban regions. So, that alone is less access to healthcare in a general sense. And then specifically for dementia, only 37% of individuals with dementia in the United States can access these adult daycare services that I'm talking about. And even more so, disproportionately rural areas are underserved. So, some national and local initiatives that this project kind of aligns with is the Community First Choice option. This was first introduced under the Affordable Care Act in the Obama administration. That this helps to expand home and community-based services, just like medical adult day centers, with medical adult day centers being more on the community-based side. But this is very limited still. We've seen in some of the literature that being able to expand these services is still very limited in rural areas. Another national initiative is the National Council on Aging. They advocate for increased funding and things for medical adult centers to help with aging in place and reduce institutionalization that we've all grown accustomed to in the United States. So the purpose behind this project is I wanted to evaluate the impact of medical adult day centers specifically on health outcomes, caregiver burden, and social isolation in a rural area because when you look at literature, this is a very limited space that has actually been looked at, and it is a massive gap in our healthcare services that's just not being talked about. The rationale here is that there is growing evidence that these medical adult day centers do improve physical and psychological health outcomes. They help to reduce caregiver burden, and they promote social engagement. Um, so the evaluation or the PICAT question that was formed for this project was for older adults in rural areas, how does the availability of medical adult day centers compared to no access to such services affect health outcomes, caregiver burden, and social isolation over the course of a year? So in order to carry out this proposal, I went with the theoretical framework of Anderson's behavioral model of health services use. Basically, what this does is it helps, it looks at predisposing factors like their demographics and their social structure, their enabling factors like their resources and access to care, and need factors like what their health status is, what is their current health. How does that influence the utilization of healthcare services? So I felt like this was a great framework to help me model my project. Also, the evidence-based practice model that I'm using is the Cotter change model. And I like this one because it's a step-by-step process, and it helps to, it's kind of highlighting the short-term wins that come along in the program. And like these pilot programs and things like where this is going to have to start, you get to kind of see step by step a little bit of progress being made. And overall, using this model, it's to facilitate change. So the methods that this was done is the approval from the Institutional Review Board, which is ASU. The internal review board there was approved from them. The setting that this project is based off of is the rural community in the Appalachian region of the United States. Our participants are going to be older adults who are at least 65 years old with chronic illnesses or a cognitive impairment. And also, we're going to be looking a lot at the caregivers because we want to see that caregiver burnout ratio. So, primary caregivers of older adults living in rural areas will also be our participants. So, the intervention is actually quite simple. Is we want to implement a medical adult day center that focuses on really four big areas, and that is monitoring their health, therapeutic activities, social engagement, and caregiver respite. So some of the outcomes there, we want to look at health outcomes for sure. We want to see if they have an improved physical or mental health, caregiver burden. We want to see if there's a reduction in their stress. And then social isolation. Is there an increase in reporting for social connections and engagement for these individuals? The timeline here is we're looking at like a preparation and planning phase of about 1 to 3 months. The recruitment and training of our staff, 4 to 5 months. Actually implementing the daycare service or the day center service is about 6 to 11 months. And then looking at the data and analyzing it and reporting is about month 12. But one of the massive barriers to this, and I'll talk about this here in a minute, is the budget to be able to do this. So estimated cost for the area are for a facility would be about $10,000. For staff salaries, roughly $40,000. Supplies, at least $5,000. Transportation, $3,000. So we're looking at a very rough estimate for this. Total, those are just the major categories at about $101,000. Of course, there's going to be more things that go into that number, but those are just kind of the majors. So in order to collect the data in that month 12 that we talked about, we want to use a couple of evidence-based assessments. So you have the Zaret-Burton interview, or the ZBI, you'll hear it called. This helps to measure caregiver burden and stress. We're using the Lubin Social Network Scale. This evaluates social connections and isolation levels. It's like a self-report model. And then health surveys, just to kind of capture overall physical and mental well-being. A lot of this is going to be patient or caregiver reported, so that's how we're going to collect that data. Statistical test, an ANOVA, or the analysis of variance. We're going to use this to compare the average scores at pre, mid, and post intervention of bringing in the medical adult daycare, and then a qualitative analysis for sure, because we really want to get the in-person interviews from caregivers to try to get insight of what was the impact on their personal life with implementing this medical adult day center. So, some of the strengths of this is, of course, it is going to make a massive impact on the community. It addresses a massive unmet need. It's evidence-based. There's lots of data, national initiatives to help back this up. Collaboration, I've got collaboration from local leaders, and that you got to have that in order for something like this to happen. And then it's cost effective because it helps to reduce hospitalizations and delays institutionalization, which is extremely expensive. So, some limitations that I've identified here are recruitment challenges, because trying to get older adults in these rural areas, sometimes geographic isolation is a massive issue. Hopefully, a solution here that I've identified is maybe partnering with some more local organizations to see maybe local churches or local transportation agencies to be able to help with that challenge specifically. That kind of ties into number two, and that's limited access to these adult day centers, and that's because of transportation services. So down the road, the plan would be to offer these transportation services, but at the beginning, offering it in a very limited access for those people that truly can't get there because of that issue. The third is cultural resistance, and that's just hesitancy towards new services, not knowing what to expect. But hopefully through education and things like that, that can also be minimized. But the biggest overall limitation is definitely funding. Finding long-term financial stability for this, not just being grant funded, is probably going to be very difficult. I've identified some possible solutions for this by, working through legislation and to try to find some backing for it at a state level. But that's definitely a potential limitation for this project. Now, for sustainability, for operationally with anything like this, you're going to have clear guidelines. You're going to have good staffing, and you're going to have good community partnerships, because this is going to be something that's truly going to transform these small communities that I'm referencing here in rural Appalachia. Financially, there's going to have to be multi-year funding and not just a one-time grant type of thing. But we do have to get it up and running to be able to show, how beneficial it is for a community. And, that's the key, is you have to find the multi-year funding. And the impact is, as long as we are improving patients' health and we are seeing that caregivers are less stressed, and we see that this is a much cheaper option than traditional care, those are the outcomes that we're trying to find and trying to prove here with this project. So in conclusion, this proposal, it definitely highlights the importance of a medical adult day center, and how it helps to improve health outcomes, reduce caregiver burden, and decrease social isolation in rural areas for older adults. The implications for this first is the clinical practice. It promotes a person-centered type of care and reduces hospitalizations. For healthcare professionals, it does alleviate caregiver stress, and that's massive, massive in our area. Organizations, that supports cost-effective care and health equity initiatives. And then for policy, it provides a model to guide rural healthcare policies and funding strategies. So, implementing this into a rural community truly does make a massive impact. Implementing these is going to be literally life-changing for many individuals, for patients of my own that I have seen, for older adults in my own family, for friends' families. But implementing these would improve the suggested outcomes that would improve their overall well-being, reduce some caregiver stress, and then also lower their healthcare costs through, hopefully delaying institutionalization and reducing hospitalizations. And I think that the literature definitely backs up that statement. So the next steps for this, of where it could grow, first would, I guess, be implementing it. and bringing it to the community and giving the pitch for the idea. But, we need to scale this a little bit too and kind of know our limitations of what we want to be and what we don't want to be. That would be the next steps. And then advocating for funding is going to have to take top priority. Personal history with this. I attempted this and quickly found out that funding for this idea is extremely limited, and it is the biggest barrier to making this happen. But hopefully, through some advocacy and things along that nature, we can find some long-term funding for programs like this. But then also, we have to strengthen our community partnerships because this is not just a normal type of research. This is going to be something that truly is going to impact individuals, and they're going to see the impact rather quickly. So we need to show that this is not just another center, but it is truly a community project and how we're kind of all in this together. So I want to give a special thank you to my mentor, Dr. Johanna Glover. Really appreciate her helping me with this project and giving me some insight and some expert opinions and things like that to help keep me on the rails. But if you guys have any info or questions about this information or have any feedback for me, I really would appreciate you just send me an email at cotydennler@asu.edu. If there is anything that I can do to help you guys, or if there's anything you'd like to discuss, please reach out. Thank you and have a great day.